Welcome back. David Hertel in for Elias. Well, a few weeks ago, the Children's Clinic that's been open for 8 years in NDG announced it was closing, and this clinic, which is not at its first controversy, let's just say that, is now blaming the MUHC for this situation. The story, as usual, broke in the Montreal Gazette by Aaron Derfel, and Aaron is on the line this morning. Thank you, as always, for your time, Aaron.
Good morning, David.
Good morning. So, what happened here? So the Children's Clinic is now closing after 8 years, and apparently there's a controversy with the MUHC about this.
Yeah, so there's a war of words now going on between the MUHC with the McGill University Health Center saying they're not responsible for the closing, but the head of the Children's Clinic blaming the MUHC for closing, saying that the owners of the private clinic had accumulated more than $1 million in back rent. They had found a third party to take over, and they were trying to work something out so that the clinic could continue. But Vince Trevisano, who's the president of the Children's Clinic,
flagged container ship in the Red Sea, according to.
Sorry, I was just hurting for something.
Yeah, I'm sorry.
He was accusing Dr. Lucio Patroni, the head of the McGill University Health Center, of showing some inflexibility. I think beyond the war of words, what this, I think, underscores is, as I tweeted the other day, the perils of private clinics partnering with hospitals in the public system. And when these clinics close, as more and more of them are closing post-pandemic, leaving sometimes thousands or tens of thousands of patients in the lurch trying to find a clinic. These are people who now they might have to travel to the West Island when they were, they're living in NDG. Mm-hmm. So it's a big mess, and again, it just it underscores the tricky relationship. And then there's another issue which I've written about, and I don't understand how this ever was accepted or tolerated, because that building, 5100 de Maisonneuve, that office building, it's owned and managed by the MUHC, and they're renting space to these clinics, and these physicians are MUHC physicians, and their patients were diverted from the Children's Hospital to this private clinic. And it's at this private clinic that these patients, the parents would have to pay out of pocket for certain tests, which, if they were provided for inside the hospital, just a stone's throw away, would be covered under Medicare. That I found always to be very troubling and perhaps unethical.
Absolutely. And we were talking about this morning, with the big news story this morning about the over 500 doctors leaving the RAMQ to go to private. We've been having this discussion in private public, but what is very strange is how, and these are my words, how incestuous the relationship is. Because if you have a private children's clinic opening in a building and the landlord is the hospital, the public hospital, the MUHC, and you have doctors sending patients to the private sector to pay for care, that I'm being told that we have to reinforce the public sector. We have to stop investing more in or diverting patients toward the private sector, and now we're seeing that the MUHC is kind of acting as if it were encouraging the development of the private sector. Am I getting this right, or am I off base?
You're getting it absolutely right, David. What you're talking about is an abdication of responsibility under the Canada Health Act and ceding it to the private sector, which raises the question as to whether the Canada Health Act is being flouted. And then that in turn raises the question as to why Health Canada hasn't fined Quebec and why Quebec hasn't enforced the Canada Health Act.
Wow.
And it, when you go back to the Glen site at the MUHC, that construction itself is a public-private partnership, which and the goal behind that was not to go over the budget. It then went over budget, and the consortium managing the private consortium building and managing the structure went ahead and sued the government for I think it was $135 million for cost overruns, and it settled out of court, and I think it got more than $100 million. And in the end, part of the reason that they had to send divert these patients from the Children's Hospital to a private clinic is they literally didn't have the space. So this is just it's one bad outcome after another that I think raises very troubling questions about so-called creeping privatization of our cherished public healthcare system. Do we want to go down the road of the United States? I don't think so, but it is. And then what you were mentioning about how more and more doctors are quitting the public system. That I think is a reflection of all the red tape that's in the public system and how it's being badly managed, but also that that these doctors are confident enough that they think there's enough of a private market, that they can carry out medicine and be remunerated for it in the private system.
And my final question, Aaron. So if the MUHC is the landlord and the clinic is apparently closing because it hasn't paid its rent, would it be in the MUHC's interest to come to some sort of arrangement with the clinic and keep it open?
Yeah, precisely. And this is where Vince Trevisano, who is the president of the Children's Clinic, he's saying that Lucy O'Patriny's predecessors, Pierre Derfel, who was the former CEO, and then before him, Martin Alfonso, who's still at the MUHC, but who was the interim CEO, he was saying that they were showing flexibility because now you've got an empty space, or you will, I think as of today, 20,000 square feet empty. There's a glutton office space post-pandemic. And so wouldn't it be in the interest of the MUHC to try to smooth things over? I was told that they wanted this to be physician managed or physician directed, and if this third party gets involved, it would be less so. So, the MUHC wants a say in the management of this, and yet it turns around and says, oh, we're not responsible for this. In a sense, it wants to have it both ways. But, the MUHC, for its part, is saying that they were flexible for how long could this carry on. I think a lot of the reason that the back rent accumulated is that you recall the shutdowns during the pandemic. There were, they were hoping to get, thousands of patients visits a week, and it was trickling to just a few hundred. And it's not just medical clinics that have closed or gone bankrupt. Other businesses, restaurants have done so post pandemic. So the question is, could they have waited a little bit longer and show more flexibility in the hope that they could get this clinic to keep it running?
Yeah. Aaron, that's all the time I have. I want to thank you again. Another very important story, a lot of serious questions being asked. Thank you for your time this morning, and thank you again for your great work.
It's my pleasure, David.
Aaron Derfel of the Montreal Gazette.